I think we all agree. Raise your hand. How many of you believe that if you operate on a patient, put an implant in, that patient's going to have a shorter penis? Raise your hand. Almost nobody. When we do it, it doesn't happen, right? Okay. So let's talk about penile implants a little bit. And the truth is that I think most of us would agree that if we look at some of the studies out there in terms of patient and partner satisfaction, comparing to what they were like before the surgery, they're dramatically better in terms of their ability to have an erection, be able to keep an erection, and obviously that's the major goal of the surgery. But they do complain in about something less than 1 in 5 cases of loss of penile length. And actually what Martin presented is exactly what I'm going to present, because he basically made my argument that it isn't real, it's a perception. But you know, in many times perception can be reality, so I think we have to look at it. So it works really well to improve erectile function, but the patients think that their penis is a little bit shorter. So I have a tough task ahead of me here. You saw Martin, obviously, he's a very talented speaker, wonderful surgeon. And if you look at his ratings, you can see this is the rating score. He got a rating of 5 out of 5. My ratings have never been more than 3, so I'm quite envious, and I guess it speaks that your patients love you. But, you know, in addition to him being a really good-looking guy, I don't know if you've noticed, but he has a remarkably small nose. It's like a teeny tiny nose, and of course there is some studies have been shown that penile size and nose sizes are directly correlated. I didn't know what his slides were, but if I did, then I wouldn't have needed to put this up because he showed us his penis on his last slide. Okay, but actually had to point it out because none of us realized. This is just another slide that shows size of penises based on the size of the countries you come from, and just pointing out that Canada and the United States are similar, but Canada wins. So you showed this slide too, and I really agree with what you're saying. And you know, I have some fun with debates, mostly because it's all done in fun. But the truth is that luckily, I usually get the side that's the correct side. And I think Martin made many of my points about perception. And looking through what I was going to try and show you to make the point of perception, you know, perception is what someone sees. But it's different in reality, where it's really what truly exists. And so perception can be biased, but certainly reality is never biased. And you have a choice in terms of what you're going to think about, what you're going to perceive, whereas it isn't a choice. Reality is reality. So most of you have probably seen this. Which of these horizontal lines is longer? And I think most of us would believe that it's the top one is longer than the bottom horizontal line, when in fact, if you look at it, they're exactly the same size. So raise your hand. How many of you thought that the top line was actually longer? Only run. The rest of you are asleep. Okay. Yeah. So now look at the central dot on the left and the central dot on the right. Which one do you think is larger? Well, in fact, most of us would think the one on the right is larger, but in fact, they are exactly the same size. So perception and reality can really be at variance. The most interesting slide I'm going to present is this one. Many of you who are looking at this slide now probably have the perception that it's moving, that there's some motion involved. Raise your hand if you see some motion in this slide. There we go, you guys are awake. Okay, in fact, it's a static image and your brain is making you see the motion that doesn't exist. So kind of interesting. You know, we have a real problem when we're talking about penile size, because if you look at the studies, and Martin showed you one of his slides where there were probably 30 different studies there, they all measure it differently. Some of them measure erect penile length with an intracavernous injection. Some of them measure it just with a stretched penile length. Some of them measure it in patients who can't get an erection. So how do you actually measure a true length of the penis? So it's a real problem. And most of this problem really is Run's fault, because he started doing this 15 years ago and publishing on penile length, and has a lot of really good studies. And this was the first one that said, yes, the penis is smaller after an implant. But I would argue, compared to an intracavernous injection preoperatively, at 6 weeks, 6 months, and 1 year, the size is really not clinically different. And I think that you'd have to be a very, very good measure of the penis. So congratulations, Run. You are the king of measuring penis length. I would have a hard time measuring the difference between 13 centimeters and 12.7 centimeters that they saw there. Run went ahead a few years later, now just 3 years ago, and did another look at the whole question of penile length, and I think he had some very salient points. And I think this is reality from my perspective, that the measurements are really inconsistent, that it's really a perceived versus an actual size difference. And although some patients probably do have some changes, it's from their recollection and that memory bias that Martin talked about, where they recall when they were 25 or 30 and they were 20 pounds thinner and their penis was much longer, and now they're thinking about what they have now, and they've gone through radical prostatectomy, they maybe have diabetes and some other things that are compromising what's going on. So, you know, when we look at what's going on with penile length, I think this is one of the best studies that's out there, because they looked at a large group of implants, more than 130, and they carefully measured what was happening to the penile length before and penile length after. And what they show here, in fact, in contrast to a length loss, they actually showed there was actually a small marginal gain in penile length. And I think most of us who do implants now would realize you aggressively size the penis with the implant, that, like in the old days where we would leave a little bit of extra length so it wouldn't perforate. Now I think aggressive sizing is really critical. And it showed that independent of the type of device you use, that they were able to demonstrate that certainly there was a significant improvement in overall penile length. So really, inconsistency of measurement, perceived versus real length loss, pre-op strategies, intra-op strategies, and post-op strategies mean that there really shouldn't be a patient today in contemporary series that has length loss. So I'm just going to show some of these things, and Larry did a nice job in this publication where he went through a very detailed list of what you can do preoperatively, intraoperatively, and postoperatively to try and optimize penile length. And I think that it's fun to be here, it's fun to have a debate, but at the end of the day, you want to walk away with something that really is worthwhile for you on Monday or Tuesday when you see your patients. And if you look at all the different strategies that this publication talks about, they average between 2.5 and 3 centimeter potential gain for your patient who has a penile implant, where size is really important. So I think that's important that you talk to them about what you want to do, what they would like to have done, whether it's a ventral phalloplasty or it's something else like a lipectomy or taking care of a suprapubic fat pad. All of these things can mitigate against that situation where you have that patient who comes in 6 weeks later and say, hey doc, I'm 3 centimeters shorter than I was. I'm an inch shorter than I used to be. What went on here? What happened? And so I think it's really important that we're armed with the idea that we discuss penile length with the patient before. We tell them that there's nothing in the literature that says you have to lose your penile length. In fact, we have a bunch of strategies we can use to optimize it and even perhaps make it better. And these are just some of those techniques that you've seen all course of yesterday and today. So, you know, the idea of fenestrating the corpora is the latest idea. You try and straighten it out as well as lengthen it as much as possible. And again, depending on what strategy you use and what the particulars of that patient are, you can realistically expect in a contemporary series to not have length loss, but maybe gain 2 centimeters or so. The idea of going ahead and doing that, the Egidio technique now, I don't think, as we heard earlier in the session, I have never done the sliding technique. I've done literally thousands of implants, and I can tell you that I wouldn't do it. I wouldn't want to have it done on me. On the other hand, the newer modification where you fenestrate the tunica in selected patients, I think is a much more logical approach, much safer technique, and I think likely would achieve sort of the same ideas. So I'm going to finish on time. I'm probably your first speaker today that's going to finish on time. The truth is that most men and most women like to have a longer penis, and I think that hopefully what you've seen now from both Martin and myself tells you that after an implant, you don't have to have a smaller penis. So in summary, use contemporary techniques, length gain is possible, no length loss can be expected or needs to be there. High patient and partner satisfaction is typically measured. It's perception. It isn't reality that they're dealing with. And so, you know, the takeaway message is length loss after a penile prosthesis is fake news. Thank you very much.